Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineeck, physical therapist.
You're the reality most famous physical therapist on the internet.
In our opinion, of course, Bob.
Brad, can you heal your injured rotator cuff? That's the question of the day.
And we have that question a lot in our comments.
Yeah, I mean, and it's a good question because it's can be a rather severe injury, but, are we going to cut right to it, Brad?
Yeah.
The answer?
Right. Well, the answer is, of course it can heal.
Yeah.
I mean, we can't guarantee 100% of them are going to heal, but as a matter of fact, we were just talking beforehand, right off the top of our head, Bob thought of one person. Was he scheduled for surgery?
They were, yeah. If therapy didn't work, he was going to have surgery. And, it depends on the grade of the tear, too.
Mm-hmm.
Sometimes it's just a little hole through the tendon. Sometimes it's a partial tear.
Right.
If it's a complete tear, rupture, where the muscle is actually starting to retract, obviously that's a case where it's not going to heal. But
that's pretty out. Your movement is going to be almost nil as pain issues. But we had a woman that she was scheduled, and the doctors didn't offer therapy, and she had to ask for therapy. And she ended up having full recovery without surgery. So
sure, it's definitely worth the try of doing therapy first.
Sure.
And we want to give you some hope to get, again, with Jay, I'm sorry, maybe I shouldn't say his name. Jay, hi Jay. He actually really had a great recovery. I mean, he's a rock climber. So
he needs it.
Yeah.
So anyways, there's 7 steps. And if you can get through
there's
these.
7 people first.
Oh, there are 7.
By the way, if you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, all this week, Brad and I are begging people to like us on Facebook. Please, please, please. All right. I'm ready.
Or
I'm
like
done.
us.
Yeah, just to like us.
Okay, so there's 7 steps. If you can get through these first 7 steps, there's a very good chance you're going to have a full recovery. Okay, so I'm not going from after the injury to throwing a hard ball, but we're doing the most critical aspect of it. And initially, when you have that injury, the first thing you need to do, if it's in pain and you got pain going down the arm and there's some swelling in there, is get a cold pack out.
Yeah, there's inflammation, so you want to knock that down.
Yeah. You may want to do some ibuprofen if that works well for you. Cold pack and rest. Just give it a few days to settle down, and then once you start feeling a little bit better, then this is probably the first, everyone agrees with this, is Codman's or the Pendulum Exercise. If this is your injured shoulder, you're going to get over and just let gravity stretch it out a little bit, get it moving forward and backwards. You can work right to left, you can work circles. Okay, but you're going to get over, because this position here, if I look at it here, I'm actually raising it this high. And oftentimes the injured shoulder, it hurts to get that elevation, that much flexion and motion.
And actually, if you go a little bit further, I mean, if you get it swinging this high, you're already that high. So you're keeping the motion while it's healing. You want me to show the pillows, Brad?
Yeah. Now, the next rule is you got those 2 are the first 2, ice and rest, get it moving with the pendulum exercise. And this kind of all fits in the same time range as avoid sleeping on it, which can be a real problem.
Yeah, so first, I mean, ideally, you're going to try to sleep off the shoulder. So, I mean, so let's say I injured this one. I'd rather be sleeping on my good shoulder, and then you can actually support this one.
Right.
You can actually put one by the side and one underneath the arm. You want that shoulder kind of in that loose pack position. It's going to heal better.
It's amazing how much more comfortable you'll be if this is the injured shoulder and you put a few pillows to support that arm and get it in the right position.
And even if you're laying on your back, Brad, you're going to want to make sure that you have a pillow underneath it to keep it supported.
Right.
Now, if you just cannot, for some reason, you feel like you have to sleep on that shoulder, you've been doing it for 100 years.
Right. Well, I just had a patient like that. He'd fall asleep, do his best, and then he'd wake up and his shoulder was killing him because he would just, by habit, in the middle of his sleep, turn over, and then the pain would wake him up.
So, yeah, exactly. So precisely. So what we're going to do is we're actually going to create the canal. So you're going to put a pillow here, maybe a smaller pillow here. You got your neck pillow or your head pillow here. You might even have 2.
Sure.
And you just go like through this, and here's my painful shoulder. And now I'm not laying on the shoulder.
Right.
And you can even lay back a little bit like this and get off the point of it.
Sure.
And it's just going to be a lot more comfortable. You got to allow that shoulder to heal. Right. So you got to make sure it's in a position so it can.
Yeah. So if it's allowed to be in the comfortable position 24/7 versus healing and doing the right thing in the day and then irritating at night by sleeping not right on it and grinding it out. That's no good.
You know, Brad, with the Codmans too, do you mind if I mention the mulligan one?
Oh, I know. That's were you on a chair for that?
Yeah, probably the back of a chair. So, you know, after you've been doing the Codmans for a while and things have calmed down, you can also do this one just because I want you to make sure that we're no longer getting that impingement that might have caused the tear in the first place. So you're going to find a chair, you're going to push down against the chair, and you're going to keep pushing down, pushing down, pushing down, and then come back up again. And that's trying to help set that shoulder down in the shoulder, in the socket,
Yep.
so that it's not putting as much pressure on the tendon anymore.
And this one, when you do it, it should feel better as you're doing it. It shouldn't create any sharp pain just in case there's something else going on. But you'll notice the right thing is, oh, it's like, oh, now I can move it. It feels better with this.
And this one, along, if once you're doing the Codmans, once you're doing this one, you can do these every hour.
Sure.
I mean, this isn't something you do once a day.
Right.
I want you to try to do this, 5 to 10 times an hour, and then you're going to see some results.
A day?
Oh yeah.
That's all right. We know
I
what
meant
you
5 to 10 reps an hour.
Okay.
Every hour.
Sure.
I mean, maybe 8 to 10 times a day or whatever you got time for. So, all right, next one, Brad.
Oh, by the way, when we say Codmans, that's the same as a pendulum.
Yeah.
I know I called it pendulum before, but
Right.
therapists kind of do that with that particular exercise. Next thing is to start strengthening it. Once you get some movement, we want to start strengthening, and we oftentimes will start with isometrics. You can go up to a wall, and here's the motion. You're either going to go, we call them outies or innies, and that works the rotator cuff muscles. If you go up to a wall, I'm going to go out. You go up to a wall, you can push there, and it's just an isometric, and hold it for about 6 to 8 seconds. And then to do the other direction here. If you happen to have some tubing, you can do it like this, get some strong tubing. If you got something to hold it like a wall anchor, and I'm just going to hold it here. And then I'm going to come over this way and hold it here.
With tension on it.
Right.
I mean,
yeah, exactly. I'm not just, that's a good point. That's what.
Yeah. So you step out a little bit even and maybe hold it.
Yeah, I'm not going to just hold it here.
Right.
I'm going to go out to this tension and just hold it.
Yeah.
And that's a real nice way to start, because once you get strong enough, the very next step is get some tension off of there and start working this exercise.
And internal rotation probably is going to be the easier one to do to start.
Right,
I mean,
yeah.
So
this is the outie one. I'll do it on this arm so that you can see it better.
You want to use this, Brad, or not?
Sure, yep, that's a really good idea. To make sure your mechanics are right, you take a little towel roll or something of this, and you put it right there, and that forces you to have good mechanics. And if that falls down, that means your elbow came too far away from your ribs. You don't have to have it as long as you keep your elbow there. And these outies are one of the key exercises. And then we do want to add
posture,
scapular retraction.
So he's bringing the shoulder blades together. Want to come out this way, Brad? You can show how he's squeezing them together. By the way, the thing under the elbow here, or the arm, they do that in golf too. They put
really?
a golfer's glove, yep, to try to keep your arm so you don't go flying out like this when you're swinging.
Sure, it's amazing how things all fit together.
Yeah.
It's kind of like physics.
Yep, there we go.
Now, we're going to go on to the next thing is, we need a big ball, Bob. Can you grab that one up
you
there?
have the Sank band, is that the...
That's what I just showed.
Oh, that's the one you just showed, okay. Gotcha.
So once you get things, you got me in there, Lonnie? Once we got the isometrics, innies and outies, and the innies and outies with motion, and it starts to feel better that way, then we want to start getting some strength and movement. I'm going to stand over here,
side?
Bob.
Okay.
So if this is my sore shoulder, both hands, my good one is going to help the weak one. And if you can do this and actually come up to here and it's starting to feel pretty good, then the next step is to take the strong or the uninvolved hand away and use the injured arm and see if you can do that and push by itself. And I have my patients, I say, roll right up. Don't let your hand, sometimes people think they have to have their hand
stop there, yeah.
glued down to the ball, but...
Because you can get a lot more motion if he goes way down. Now look how high up he really is. You want to stand up?
Oh, sure.
Look at that.
Yep.
So...
And the ball's supporting the weight, so it takes a lot off. And once this becomes good and you're feeling stronger, at this point you can start to lift your shoulder up and it's feeling pretty good. Then you're going to take the ball and go to the wall. So I call it the ball up the wall exercise.
And now look, he's using both arms to start off with. So he's kind of getting active assistive device.
There we go.
By the way, Brad, this is a very good suggestion. I have not done this. I am going to incorporate this.
The ball up the wall. There's nothing better. Then once both arms work well, then you take the weak arm, the injured one, and then you start to incorporate that. And then you can also put a little pressure on the ball and lean into it, which causes more co-contraction on the rotator cuff joints.
And really have good posture while you're doing these. Yep, good posture, and because you want that shoulder to be supported by its base. And also, I don't know what else I was going to say. Yeah, that's good.
That goes with age, Bob. That happens to me all the time. So when you get to this point, and you can do this with one arm, you got to be feeling really good. And we've got some advanced strengthening exercises if you want to be a thrower or something like that.
Well, if you're up to one arm, you're doing pretty good. You're starting to get back to normal then.
But there are more exercises that are a little more advanced.
Yeah.
And we have those. Just look it up on Bob and Brad, and rotator cuff for throwers is a good one, for example. So I want you to be careful, Bob, on anything that you do, and if you're not careful, have fun.
All right, sounds good. Thanks for the advice, Brad.